name is Connie Goodson, still with you guys, because I'm seeing that I'm having some connection issues. And today I want to talk about, Lindsay, can you hear me? Uh-oh.
Yes, Connie, we can hear you.
Oh, good. Okay. All right. Okay. So today I want to talk about our Coordinated System of Care, or CSAC. You can just go to the next slide, Lindsay. Okay. Next slide. Volume is choppy. Uh-oh. Lindsay, next slide.
Do you see objectives?
Yes, I do. I do. So the objectives for today are to talk a little bit about the history of CSAC, to discuss Wraparound or Child and Family Team Process, to talk about the role of our family support organization, the role of our CSAC contractor, and then to discuss outcomes and lessons learned. Next slide. So our history. Back in 2009, Louisiana's Child Serving Agencies created a collaborative leadership team. And they were, oh, next slide, Lindsay. Thank you. They were really concerned with our over-reliance on residential care for children with significant behavioral health challenges, levels of care, behavioral health services for our high-risk youth and their families. In addition, the group really identified the following system problems: a lack of home and community-based services and supports, the deficits-based medical model limiting types of interventions, racial and ethnic disproportionality and disparities, and also fragmentation of services, which oftentimes result in high cost and poor outcomes. Next slide. Oops. Next slide. Oops, I'm having internet problems. Thank you. The key partners were Department of Child and Family Services, Department of Education, Department of Health, including OBH, OCDD, and Medicaid, Juvenile Justice, advocates, families, young people, and the governor's office. And really in 2010, the members of the leadership team met on a regular basis, really to look at solutions, to really engage national experts and evaluate potential options. The goal was really to create a win-win for everyone. Child welfare was looking for alternatives to out-of-home placement. Juvenile justice was looking to alternatives to detention. Medicaid was looking for alternatives to inpatient or PRTF. And education was looking for alternatives to out-of-school placement. Each of these coming oftentimes with high cost and not great outcomes sometimes. Next slide. Next slide. Thank you. So they've decided to go with system of care. And why system of care? According to a national evaluation of systems of care, youth involved in these systems demonstrate many functional, behavioral, and emotional improvements, including spending more time in school, fewer arrests, and really improved emotional health. Next slide. Louisiana adopted system of care values, including family voice and choice, which really means nothing about us without us, focused on home and community-based services, using a strengths-based orientation and language to create individualized plans that are culturally and linguistically competent and integrated across systems. CSAC focuses on connecting families to natural helping networks, and we're data-driven and outcomes-oriented. Really, practice shifts us from control by professionals to really partnering with families. It shifts us from using only professional services to partnering with natural supports and professional services. It moves us from having multiple case managers and plans to having one wraparound facilitator and a single individualized child plan meeting the needs of both. And most importantly, it shifts us from a deficits perspective to a strengths-based perspective. Next slide. The goals of CSAC are to improve the overall outcomes for children with significant behavioral health challenges, to reduce the number of children and youth in detention and residential settings, and to also reduce the state's cost of providing services by leveraging Medicaid dollars and other sources. Next slide. So implementation. So CSAC started in March of 2012. We first implemented in 5 regions of the state, and at that time we had the capacity to serve 1,200 youth and families at any given time. In phase 2, we got permission from CMS to go statewide, so we implemented in the remaining 4 regions of the state, and we were able to increase our capacity to serve 2,400 youth and families at any given time. You can go to the next slide, and there'll be a state map. And you can see this is the CSAC regions. There's 9 CSAC regions, and we've got 1 wraparound agency in each of the 9 regions. Those wraparound agencies are responsible for serving the youth and families in that region. So I'd like to talk a little bit about wraparound or child and family team process because it really provides the values, principles, and framework for CSAC. First, I want to talk about who is a CSAC candidate. So youth are eligible for CSAC if they're between the ages of 5 and 20 with a behavioral diagnosis, who meet clinical eligibility, and have a primary caregiver who's willing to engage in the wraparound process. Wraparound is a very intensive program, and it really requires a lot of participation from the family and caregiver. Generally speaking, meetings take place at minimum 1 time a month, and the expectation hope is that we engage the family, their extended family members, and also natural supports to come together. Oftentimes, the children are multi-system involved, and they're in at risk of out-of-home placement. So I want to give special consideration to 2 groups of children. Children discharging from psychiatric inpatient hospitalization can be referred to CSAC prior to discharge. The wraparound facilitator can help in discharge planning. And also children discharging from a PRTF or a TGH. These referrals can be made 30 to 90 days prior to discharge. For these particular children and their families, a referral to CSAC can significantly increase the chances of a successful discharge to home. The wraparound facilitator can support the youth and their family in the transition in identifying supports and services they need to make it a successful transition. Next slide. So the role of the wraparound facilitator is to help a family build a team of professional providers, national and community supports to help identify the child and family's unmet needs. At its core, wraparound or child and family team process is really a planning process. It's not a clinical intervention. It's collaborative and team-based. And the ultimate goal is to improve outcomes and decrease per capita costs. Slide. The goal of the team is to really create an individualized plan for the child and family that's built off of their strengths to meet underlying needs that's supported by all members of the child and family team. These plans should really be proactive, future-oriented with what the family is hoping for, what their goals are, and what their ultimate family vision is. Next slide. Youth and families enrolled in CSAC receive wraparound facilitation, which is delivered by highly trained wraparound facilitators. They also get connection to our statewide family support organization, which is staffed with parents and youth with lived experience. And they can also receive 2 other specialized CSAC services, short-term respite and independent living and skills building. In addition, they have access to all Medicaid state plan services. Next slide. I want to take a minute to talk about this slide. These are the principles of wraparound, and CSAC reflects these principles. So there's 10 principles that guide child and family team process. I'm just going to discuss each one of them briefly. The first is family voice and choice, which is really important. Really, what that means is nothing about us without us. The role of the wraparound facilitator is to really ensure that the family and youth's voice and choice is heard by the team and prioritized. At its core, wraparound is a team-based decision-making process. We encourage families to include their natural supports, those people who are important to them and who've been there for the family in the past. Wraparound builds collaborative relationships between team members. The team has a shared responsibility to develop, implement, and monitor a plan through consensus. The goal is really to move the family to independence away from wraparound. This process requires an understanding and respect for the values, preference, beliefs, and culture of the youth and family, and the wraparound facilitators take a long time in the beginning of wraparound, engaging families, helping to understand what's important to that family, and making sure the team sees the family from a strengths-based perspective. Each plan the team creates is designed to meet the needs of that specific youth and family, and it's really informed by their identified strengths, their needs, and what their values are. The process focuses on and builds on the strengths and abilities of the youth and the family and the team members. I think most importantly is it's a process that operates with unconditional care, which really requires persistence and patience. I'm recognizing that continued behavior is not a reflection of failure, but really evidence that a plan needs to be revised. From my perspective, wraparound is a little bit like making a garment of clothing. And if anybody's ever had a dress made or a suit made, or just envision that, you take a piece of fabric, you've got some sort of an outline or a pattern, and the dressmaker or tailor will begin to fit that to you. And, if you've ever had a garment like that made, you'll know that there may be multiple fittings. Wraparound is all about precision of fit. So we keep coming back to the table to see if the strategies and action steps that we've identified, whether they're working or not working. If they're not working, we don't say, oh, this is just not ever going to work. We continue to try to sort out what is the need and how can we best meet the need. And that really takes us to outcome-based, because wraparound really requires accountability, where the family's goals are reviewed on a regular basis, action steps are revised as needed to support the family in reaching their goals. Next slide. So this practice really moves us from seeing families as dependent and incapable to really seeing families as competent with expertise. We move from seeing families as unreachable and fragile to seeing them as resilient and collaborative. We move from seeing families as system dependent and over-reliant to really an awareness of the family's internal strengths and resources. And again, most importantly, we move from pathology and blame to really understanding families and help to create optimism and hope. Next slide. This is actually an illustration of what planning might look like for a multi-system involved youth and family without the child and family team process. You can see that families are expected to meet expectations of multiple systems with multiple plans that have different and maybe competing mandates. And then you can go to the next slide. This is what planning looks like with the CFT process. One wraparound facilitator brings together all relevant team members, inclusive of involved systems, as well as the extended family members, friends, and community resources, and the team creates one cohesive plan guided by the family's identified strengths, needs, and preferences. I think that these are two really important slides because they show you the real difference for families that are involved in CSOC as opposed to families who are not involved in CSOC. Next slide. Actually, before we go to this, I just want to talk a minute about if you are a part of a child and family team meeting, how to be an effective team member. And I think that it's really important to recognize that this is a team decision-making process. So one of the most important things is if you're part of a child and family team or a child that you're working with is part of a child and family team process, that you be there. Showing up is very, very important, and it's sometimes really challenging for people because child and family team meetings are held at the time and place it's most convenient for families. So sometimes it's in their home, sometimes it's after hours, but being part of that team process is incredibly important. It's important to really listen well, to acknowledge and value all perspectives, even if you don't necessarily agree with that perspective. It's important to participate actively and share your ideas, but recognizing that maybe that your solution may not be the one that the team selects. I would say don't be afraid to ask questions. The wraparound facilitator should be there that you can ask questions to. You can get some idea of, what the family story is. It's important to be flexible and open-minded and to really go in. Hoping this is working. My internet connection says it's unstable. It's important to keep your commitments. If you say in the child and family team meeting you're going to do something, then it's important to do it. And I think most importantly, it's just important to work with the team and support the process because it's a very effective and dynamic process. Now I'm going to talk a minute about the Family Support Organization. So CSAC is a single statewide family support organization, which uses a centralized intake process. The FSO people participate in child and family team meetings. They provide parent support and training and youth support and training in accordance with what's on the child's plan of care. And they also promote the values of CSAC and the values of Wraparound. Next slide. Behavioral Services Louisiana is our family support organization, or FSO. They began providing services to members in 2018. All CSAC members have access to the following services: parent support and training, connects families to caregivers of children with similar challenges, providing support and helping to connect them to their community. And youth support and training connects youth with young people who've been involved with behavioral health services or have had other system involvement to provide peer mentoring and support. Next slide. So the role of the FSO and CSAC is to really help families understand the wraparound process because it's oftentimes unfamiliar to families. It's to help ensure the family voice and choice is maintained throughout the process. And it's also to help assist families in system navigation and also to assist youth and family in developing and practicing new skills. Next slide. So I want to talk about our CSAC contract, which is Magellan of Louisiana. Next slide. CSAC has been administered through our CSAC contract in Magellan since its inception in 2012. The funding for CSAC is through a Medicaid waiver. We can serve 2,400 youth at any given time. The CANS, or Child and Adolescent Needs and Strengths tool, is what we use for eligibility and outcomes. And Magellan's responsible for managing eligibility, compliance to waiver performance measures, quality, and outcomes. Next slide. Now I want to talk about the referral process. So the way you access CSAC is really through a youth managed care organization. The family may reach out to their MCO with concerns about a child's behavior. The MCO will ask the family 3 questions, which is really the first step to the wraparound process, the referral. These questions evaluate a youth's risk behavior, including harm to self, harm to others, or engagement in high-risk behaviors. If the family answers yes to one of these questions, they're offered an opportunity to be transferred to Magellan for further evaluation for the CSAC program. Next slide. So once the family agrees to the transfer, a Magellan care manager will conduct a brief CANS over the phone with the caregiver. The caregiver is asked the questions that are related to these 4 domains: child's risk, their functioning in the home and community, their clinical functioning, and caregiver strengths and needs. If there's a positive score, this indicates presumptive eligibility in CSAC for 30 days. Magellan will make a referral to the regional wraparound agency for further clinical assessment, including a comprehensive CANS, the results of which really determine clinical eligibility. Next slide. Usually I ask for questions during each one of these, but I hope people are saving their questions to the end. So let me talk about our outcomes and lessons learned. Next page. So as I previously stated, CSAC uses the CANS assessment as an evaluation tool. For each child who comes into CSAC, a CANS is done at enrollment and also at discharge. And then the scores are compared. Our most recent data indicate that almost 79% of youth demonstrated improved clinical functioning. And really what that means is a decrease in child risk behaviors and child emotional behavioral health needs, and an increase in child strengths and the child's life domain functioning. In addition to that, 56% of youth demonstrated improved school attendance, 68% demonstrated improved school behavior, and over 71% demonstrated improved school functioning. Next slide. So most importantly, 88% of youth and families increased utilization of natural and informal supports. And this is really important because research indicates that those kinds of connections are key sustaining factors to helping families maintain progress that they've made in CSAC. And 98% of youth were discharged to home and community-based setting. Next slide. This is a little bit more about the CANS outcomes. I think this is a really great slide to show the differences between a child's challenges at enrollment versus discharge. The dark blue line is where a child was at on, let's say, impulsivity at enrollment. And you can see the lighter blue line, you can see the decrease when a child's discharged. And I think this slide really shows the declines we're seeing in some of the really high risk behaviors that contribute to inpatient hospitalization and residential treatment. In this, where the red box is. Pretty significant changes. Okay, so in terms of our lessons learned, system of care work really requires culture change. It really requires us to move from a more deficit-based perspective to a more strengths-based perspective, which is really a developmental process, and it requires a lot of patience and persistence, I think intention, and leadership. It really requires us to take responsible risks, adopting a positive intent viewpoint, and becoming an accountable ally to the families we're working with, doing with and not to. Collaboration with other systems requires a willingness to understand the orientation and mandates of partner agencies. I think system of care work offers an opportunity to develop a shared language and vision guided by system of care values. And lastly, system of care is dependent on having a full continuum of care, including inpatient, residential, crisis response, outpatient, in-home services, as well as natural, informal, and community supports and services. Next slide. CSAC represents a milestone in children's behavioral health in the United States. CSAC is an innovative reflection of really two powerful movements in American healthcare. One is coordination of care for individuals with complex needs. The second is youth and family directed care. I also think that CSAC is a demonstration of the power of collaboration between state and local government agencies, community stakeholders, youth, and families. And the last slide, I have a variety of resources. We have a website. I've got our website page up there, and certainly Magenta, Louisiana, our contractor, their website is up there. National Wraparound Initiative website has lots of information about Wraparound, what the process looks like, research that's been done, and other folks that have lots and lots of information about Wraparound. That's it. So does anyone have any questions or comments? Put things in the chat box. Is that right, Lindsay?
Hey, Connie, thank you very much. Steve Philippi, I really appreciate just the overview, the history, and the update. If you could identify just one or two things where you really envision CSAC going in Louisiana in terms of major next steps, what would you categorize those as?
Well, first, I think I want to talk a little bit about how ambitious I think the state was in bringing CSAC as a statewide service, because I can tell you that there are wraparound programs throughout the country. Every state has a wraparound program. Most states do not have a statewide wraparound program. So, I mean, it was a very ambitious project. I think that Louisiana was very ambitious and also future thinking. The other thing I want to say, and I know this isn't really answering your question, but I think the other thing I want to say is that a lot of the programs that are in different states are kind of like boutique programs. So they might serve 100 children. And so like I said, I think that our state has done a really wonderful job bringing CSAC to the state, to the kids and families in the state. And certainly over the past 8 years, I think that we perfected a lot of our process. So, you know, my hope is that, you know, I anticipate CSAC maintaining. I think that we've got very good outcomes. And my hope is that at some point we'll be able to increase the amount of children that we're serving. Does that answer your question?
It does. It actually prompted one other question, then I'll stop. But obviously you have a lot of variation, different providers doing wraparound in the state. Is there any comparison of the quality or ways to capture quality differences so that we could replicate those and benefit from them across?
Okay, so actually, we have, let me just talk about this for a minute. We've got 9 wraparound agencies. Those agencies only provide wraparound. They're all trained in the same training. They receive the same supervision and coaching. So there's actually a pretty extensive training that goes into developing a wraparound facilitator. So in terms of, so for those 9 wraparound agencies, they are getting the same training. There's a huge coaching component to this particular program, because really, when you look at those 10 values, those values that I think we all can agree on, that we want to work with families, you know, with voice and choice, strengths-based, collaborative. Some of those values in application can be really challenging. So the coaching piece helps a facilitator kind of navigate, you know, taking things from theory to practice. So from that perspective, my hope is there wouldn't be a lot of differences in terms of what wraparound looks like from one region to the next, because there is a standard format. It's a 4-phase process that everyone is trained in. What I will say, and I was debating putting that in this particular PowerPoint, is that actually we do evaluate fidelity. Dr. Eric Bruns from the University of Washington, he actually runs the Wraparound Evaluation and Research Team. And probably since 2014, we have had an annual fidelity evaluation that has been really conducted through them. And our scores have been compared to the national means. I see a question. Our scores have been compared to the national means, and we have exceeded the national means in every element. So that is something that's ongoing. We do an annual fidelity survey, which really is evaluating, are we practicing in a way that's consistent with wraparound values? Does that make sense?
It does. Thank you. And congratulations on those fidelity scores. That's fantastic. Thank you.
Certainly. I debated putting it in here because it kind of gets in the weeds, you know, and I just wasn't sure if it made sense to get into all of that. But I certainly can, I think that someone's asking if that is available. And I believe that we have actually shared that. We have a CSAC governance board meeting quarterly, although since COVID, it's been pushed back a little bit. But we share that information with the governance board annually. So if you go on our CSAC website and you go to CSAC governance board, you will see I do a director's report quarterly, and we also share data quarterly with the governance board. All of that is there. There's lots of information on the CSAC website. Now, I think there was another question that I saw. I'm sorry, it says your slide said the capacity is 2,400. How many are being served per year? To give you the exact number, I don't have that exact number. I'm going to say probably around 4,000 because, of course, kids are discharging and enrolling all the time. In terms of our fidelity data, that is actually on our CSAC website. Any other questions or comments? I do want to say this. Since COVID has come to be, we've had a decrease in referrals to CSAC, and I think that there's a couple different reasons why that's happened. One is, the kids have not been in school, and frequently anybody who works with children knows that in the summertime, usually, referrals go down, and then when school starts, referrals go back up again. I mean, there's a lot more stressors for kids when they're in school, and there's also a lot more identification. So kids have been out of school since March. So we haven't, and of course, they're not in the community. So I think that there's probably children in the community that could benefit from CSAC that we are just not, we're not connecting with. So I know, I'm just going to say to the audience, if you know of a child or a family who could benefit from CSAC, it would be, I would really, doing a referral, we've got openings right now, we've got availability, and I think that given the current stressors that people are under today, that CSAC may be a very, very good resource. The other thing I'm going to say is that CSAC has continued. Of course, we generally speaking do face-to-face work with kids and families, and we've done telehealth now. So Wraparound agencies are doing telehealth. The FSO is doing telehealth, and so we are continuing to support our kids and families. Let's see. There's a question about Magellan paying for providers for psychological assessments for concerns of ASD. I think actually I should have made this announcement earlier. I think there's somebody from Magellan on. Brandy, are you on, and could you answer that question? If not, I can take the question back.
Can you hear me, Connie?
Yes, I can.
Okay, great.
Thank you.
Yes, so
sorry,
Brandy Johnston. That's okay. I actually had some difficulty calling in, so I was a few minutes late. So yes, as far as psychological testing, that is a service that is covered by Magellan for kids who are in the coordinated system of care. There are a couple of things that have to happen in order for that service to be authorized. As Connie has said, each youth has a plan of care, and so the service of psychological testing would be included on the plan of care because the whole team comes together to decide which services are best for the youth. And so if the team decides that the youth needs some type of psychological testing, that service is added to his or her plan of care. And then there is also a form on our website that the person who's going to be doing the testing fills out because they have to list a specific test and the time so we know exactly how long to build the authorization for. But yes, and I think it said in your region, not sure if there's someone approved to provide the service. And so Region 5, okay. So we have a network management specialist who I can ask to reach out to you. And so what I'm going to do is I'm going to write down your name. And if you want to, I don't know if you feel comfortable putting your email in the chat box, and so I can have it emailed to you. Or if you want to email Connie, because her email address is at the bottom of the screen.
Right.
If you want to email her, right, your information, then we can get you a list. Does that answer your question? Great. Thank you.
Okay, I see another question here. Can you explain how wraparound agencies choose a behavioral health provider for a child? The wraparound agency does not choose the behavioral health provider. The child and family team, primarily the parent, would do that. And you know, there's usually several different people that a family can choose from, and you know, it's based on whatever makes sense for that individual child and family. So, but it's not a wraparound agency decision. As a matter of fact, really, decisions that come out of wraparound really are coming from the child and family team process, with the family really prioritizing things. I'm looking for, I hope that answered your question. Sometimes youth are sitting for days in emergency room under PEC waiting for inpatient bed, but they may not really need to be admitted, can be appropriate for CSAC. I think that you're probably right that children that are certainly going to the psych ED probably could well be served by CSAC. That would be a decision that would be made with the MCO that's working with them, or I'm assuming the child's not already in CSAC, but a family can make that request. So the process has got to be followed. So a family just needs to reach out to their managed care company, and the managed care company can get the referral going, and then the wraparound agency can get involved. So yes, if that's a challenge, that you know, the family can always call their MCO and say, I want a CSAC referral. I want a child to have a CSAC referral. Does that make sense to that? I'm sure. I hope I answered your question, Michael. And then there's a question about, oh, good. Is prior authorization required for CSAC? I just want to make sure that I understand your question. No. What needs to happen is the family needs to call their managed care company, and their managed care company will follow the process that I explained in the PowerPoint. And there's certainly, if the family answers yes to one of those high-risk questions, you know, they are warm transferred to Magellan. The Magellan care manager will do the brief cans, and if there's a positive score on that, the whole referral process is kind of there's a sequence of events that happen for behavioral health providers. I think, Brandy, I'm not sure if you're still on, or if you're
I am.
talk, but I think there is how behavioral. Yes.
Sure.
I would.
Okay, so as I referred earlier to the plan of care, so again, all providers who are providing services to the youth and family will be listed on that child's plan of care. And so the wraparound agency completes the plan of care after the child and family team meets, and they determine which services and which providers will be listed on the plan. The plan of care is then submitted to Magellan, and we review the plan of care and build the authorizations directly from the plan of care. Now, I will say there are some services that are not built from the plan of care, such as hospitalization. So if one of our youth does have to go into the hospital, those authorizations come through the telephone. The hospitals call us directly and give us clinical information within 1 business day of the youth being admitted, and that authorization is built from that clinical information. Another service that is built from a telephone call is crisis intervention. So the first 6 hours of crisis intervention are what we call pass-through. That means they do not require an authorization. But anything after that first 6 hours, we have to have a phone call come into us so we can get the information, what's going on with the crisis situation. And again, we make sure that provider is listed on the child's plan of care. Other services that have pass-through units, which mean they don't have to have an authorization built, is psychiatry. So Medication management is allowed 12 sessions a calendar year without having an authorization built. And visits with a LMHP, so a licensed mental health professional, those are allowed 24 sessions in a calendar year. Now, if the child uses up those 24 sessions and they still need to continue to see a LMHP, as a lot of our kids do, then what we do is the wraparound agency will request that authorization again through the plan of care, because that's where all services are listed on that plan, and they will let us know that they have exhausted those pass-through sessions and that the youth is seeing a counselor once a week, and so therefore they need, an authorization built for this many more sessions. Does that make sense? Okay.
Okay. Any other questions that folks might have right now? Well, as Brandy indicated, my email address is at the bottom of this slide, and people can reach out to me. Oh, what is the criteria that determines when the child and family transition? Okay. When a child is discharged, so when a child's being discharged from CSAC, and that's also a process that Brandy might want to talk about. I will say this, when a child is in CSAC, Magellan pays for the child's specialized behavioral health services, but that child still is connected to their managed care company for physical health and for pharmacy. So while the child is in CSAC, there is communication between that child's MCO. Actually, Magellan has an MCO liaison who is constantly in contact with MCOs that are involved with our children. When a child is coming up to discharge, there's really communication between Magellan and the MCO that the child's being discharged back, and there's information that Magellan sends to the MCO where the child's being discharged back. So really the criteria is when the child is being discharged. Does that?
It does. Thank you, Connie. I was able to now come off of mute. So yeah, I'm having some problems with my system as well. So thank you. And
yes.
What is the recommended cadence on contact between the MCO and the Magellan coordinator? Is it every 30 days, maybe, or?
I think that's kind of dependent on what the needs of the child are.
Okay.
I think that there's regular communication. Yeah, and I mean, if there's something that comes up, if there's some emergent issue, the Magellan will reach out to the MCO about that particular child.
Okay, makes perfect sense. Thank you.
Certainly, certainly. No more questions? Well, I want to thank everyone for your participation in this. You know, as I said, I've been here for 8 years now, and I think, as I said earlier, I think this is a very ambitious program the state took on. I have been doing wraparound work for over 16 years. Prior to being here, I ran a wraparound agency. I believe very, very, very deeply in this process. I think that it can be really complicated because, as I said earlier, those 10 principles and values that I think we all embrace can be very, very difficult in the real world. So, I mean, if you're involved with a child who's involved in CSAC, your support and participation in the process is just vital, because team cohesion and having bunch of people coming together and sharing ideas and solutions to help support a family and child to be successful is really important. And the more the people, the more ideas you have, the more choices you have about how to move forward. So I appreciate all of you. Thank you for this opportunity. And you can go to the CSAC website, and there's lots of information about our program. And the NWI, National Wraparound Initiative, has a lot of information about Wraparound. So thank you very much.
Thank you, Connie, for joining us this morning, and Brandy from Magellan for asking some of our questions.